it. October is Breast Cancer Awareness Month, as many of us are aware of. The goal is to shed the light on breast health and promote early detection. And Southwest Medical's breast care program is doing its part to heighten awareness, not just this month, but throughout the whole year. Joining us today is Linda Rittenberg, RN Director of Specialty Care at Southwest Medical. Good morning, Linda.
Good morning.
I am so glad you're here. We've been talking almost every day on the show about breast cancer or breast cancer awareness. I'm wearing a little pink pin today. There's lots of people raising money.
Yes.
But what's it all about this month? What's the goal?
Well, I think the goal is to really raise awareness of breast health issues and provide education. Definitely focus on early detection and the screenings that are available out there for women.
Absolutely. So speaking of early detection, tell us about the programs you have at Southwest Medical.
Well, at Southwest Medical, we offer mammogram screening at most of our health centers. We have 30 health centers throughout the Las Vegas Valley, and most of them do offer mammogram services. We also now have our Medicine on the Move mobile unit, where we have digital mammography available on that. So if you're at a healthcare event where Medicine on the Move is there, or it's on site at your place of employment, we do offer mammography there for
you
patients.
can get a mammogram on the bus.
Yes, you can.
How great.
Yes.
Now, you said digital mammography.
Yes.
So is this a different machine than I have experienced? Or is
Well,
everything digital now in
Well,
a mammogram?
a lot of the providers are going digital. What's really nice about digital is your mammogram can be accomplished much more quickly than it was in the past.
I like quickly.
Yes, so you still get that little bit of discomfort with the squeezing and the squishing that we don't like, but it's not as long-term as it was in the past. So the technology is more advanced now and makes it more comfortable for us.
Okay, comfortable is good. I know mammograms have come a long way. I remember my mother telling me about them in earlier decades. They weren't as comfortable. Let's talk about the recommendations. So what are the current recommendations for mammography?
Well, there's been some confusion about the recommendations over the last year or so. At Southwest Medical, we're recommending a yearly mammogram for women 40 and over.
Okay.
And so that's also, we want every adult woman to do a breast self-exam monthly. So important, because women know their bodies better than anyone else does. And a lot of times, that's where your cancer is picked up, is very early by the woman herself. So that's important. Women over 40 should get a clinical breast exam annually by their provider, and women 20 to 39 should have that done every 3 years.
So remind me, because I've been taught by doctors on several occasions how to give a self-breast exam. I'm pretty in touch with my body. I'm pretty aware. I'm always concerned about finding a lump. What are the signs and symptoms of breast cancer?
Well, one of the things you want to do first is look at your breasts. Look in the mirror. Take a look. Do you see anything differently?
Okay.
Is there anything different about the nipples? Are you seeing any discharge? Do you feel a lump? Is the lump on the breast? Is it under the armpit? Are you feeling any breast pain? Is there any redness, any unusual swelling? Do you see any dimpling of the skin, kind of like the skin of an orange? We call it orange peel skin.
Really?
Yeah. Do you see any retraction of the skin, meaning it's being pulled in somewhat? And those are all signs that you would want to get to your provider and talk to your provider about. A lot of times it's not breast cancer, but we just want to be on the safe side, because early detection is the key. You know, that we have successful outcomes with early detection.
Okay, very good. Now, you have a breast care program at Southwest Medical.
Yes, we do.
Tell us all about it and what that entails.
Do. So when a primary care provider refers a patient for a diagnostic imaging study, we offer diagnostic mammogram and ultrasound in our breast care program. And then we have a team of advanced practice registered nurses, RN navigators, physicians, and radiologists who are there to give us that diagnosis. When the patient receives that diagnosis of breast cancer, we're there to offer one-on-one consultation, help the woman deal with the emotional and the physical crisis, and then get her through the system, help her get through the system for treatment, whether that be surgery, whether that be chemotherapy, with close one-on-one team approach follow-up.
I'm sure it does take a whole team. I think
It
that,
does.
no woman obviously wants to hear that diagnosis.
Right.
It's very intimidating. So you're saying it takes a whole team of people
It
then
does.
to help a woman through this situation.
It does.
Yes. And you have seen an increase in mammograms in your program in the last few years.
We have.
Tell me about that. And what do you
We have.
what do you
In
make from that?
2015, we did 39,000 mammograms, and this year we've done 42,000 thus far. So we're getting out there with our message.
Yes.
We are definitely, we're out in the community, we're at healthcare events. This weekend, we're going to be at the Age Well Expo
Yes.
at Cashman Center on Saturday. You'll be able to come in and schedule a mammogram with us at one of our healthcare centers at the Age Well Expo. And I think it's just getting the message out and reaching out to women and the public and saying, do this for yourself.
Absolutely.
Do this.
Early detection is the key. Thank
Yes.
you so much
Thank
for joining
you.
us. Join Southwest Medical this Saturday at Age Well Active 50 Plus Expo. The event goes from 9 a.m. to 4 p.m. at Cashman Center, and it is free to attend. To learn more about Southwest Medical and their breast care program, visit the website on your screen. They're also on Facebook and Twitter. Sean, over to you.